Now you know. All right, all right, all right, all right.
All right, all right, all right.
Many things give me joy. But there are a few things that literally blows my mind out of the
Speak, Sam.
everywhere.
Speak.
And that one thing is people that do amazing community things. And there's one person that I just recently met, and she's a bomb.
Oh my goodness,
The work
Sam.
that she does is so important. And she does it even in situations where for her herself, her safety is not even promised, yet she keeps going. Please join me as we together have a conversation with the vivacious, the voracious, the non-stop fighter,
goodness, Sam.
Dr. Ify. Dr. Ify.
How do I follow that?
Ay, ay, ay.
Ay, ay, ay. Ay, ay, ay.
Dr. Ify,
Sam.
please, can you educate us on the statistics? I like it when you say Sam. Say it again.
Sam.
Sam! Okay, get serious. Can you educate us on the statistics of breast cancer and the situations around legislation, and what does those numbers look like right now?
Well, breast cancer it's a reality for a lot of women right now, right? And we're facing an issue right now in Canada whereby we're working on the breast cancer screening guidelines. They're out. They're in a draft form. And the issue we're having is that as breast experts, we're saying we want to see women screened at age 40 because when you screen at age 40, that's when you save the most lives. The Canadian screening guidelines right now, though, they're saying start at age 50. Okay? The issue as it relates to a lot of women, especially a lot of racialized women, is that in racialized women, breast cancer peaks at an earlier age in the 40s versus when you compare it to white women, it peaks in the 60s. So if you start screening in the 50s, you're excluding a huge number of people.
Oof, of course.
And especially as it relates to Black women, the statistics as it relates to Black women it's terrible, quite frankly. We are more likely to be diagnosed under 50. More aggressive cancers, breast cancer stage for stage, more likely to die, more likely to be diagnosed with locally advanced or metastatic disease. There's a type of breast cancer it's called triple negative. That's one of the most aggressive cancers. Black women are more likely to be diagnosed with that, more so than white women. So when you screen, the goal is to find it, if it's there, early, small, because size matters. Quite frankly, if you catch a cancer at stage 1, the cure rate is almost 100%, versus if you get it at an earlier stage, at a later stage, like in stage 3 and 4, which unfortunately most Black women tend to be diagnosed at a later stage, right?
Why?
Well, there are a lot of factors. Part of it is genomics, or our DNA. Part of it is, with Black people, Black women, there tends to be more diseases such as high blood pressure, diabetes. A large part of that is pattern of care. So what I mean is looking to get checked. This is something that we need to talk about more. We need to normalize the conversation. It shouldn't be something taboo. Young girls should be able to talk about this to their moms, to their aunties. And the more we talk about it, just like you and I are talking about it now, we can normalize it, right? And so that when there's an issue, you can go and present yourself and say, hey, this is what's happening. Go for the screening. As you know, there are a lot of cultural things where, we like to, don't talk about it, and hide it. And I always say, one of my posts on Instagram, I said, there's a lot of talk about women and power. We get the power to choose. Use that power to choose to present early. So that if there's something going on, we find it at a small stage, small size, at an earlier stage, small size, and we can deal with it.
Yeah. Dr. Ify, I like that you mentioned the cultural situations or the stigma that could show up in this conversation for Black women. But I'm curious as to what practical steps can we take for Black women? You being in the forefront of this conversation, what have you seen? What have you heard? What steps can you advise for our sisters, our mothers, our partners, our loved ones to take in situations like this?
Okay, I would say, like, if you have breasts, you should want to know about them and take care of them, right? So one of the things, I just recently attended a webinar and I asked that very question, as it relates to Black women, what's the conversation like between family doctors and women, And And I asked that question particularly because if you look at the Canadian screening guidelines, it does say don't screen in the 40 to 49 age group. But when you look at Black women, the mortality is higher. So there's that difference. So being that we're in a high risk category, what's that conversation like? And I'm not so sure I got an answer. Well, one thing they did say is advocacy is important. And that's where, I look at myself, here I am, it's a unique position. It's something that affects me. It affects all women. So I like to use my voice in this position to talk more about it, to raise awareness, where I can talk to family doctors. I've talked to a bunch of women, so I just want to raise awareness and speak about it as much as I can to anybody that will listen. What I'm doing right now is I'm forming a website. I won't tell you what the name is right now, but on this site, it's going to come. It's coming. It's coming. On this website, I'm going to discuss articles that pertain to breast cancer, and it pertains to all women, racialized women, Black women, right? There's a lot of imagery pertaining to breast cancer that's more focused on white women. You don't see it so much in Black women. If a Black woman goes through radiation, what is that like? What does that look like? You hear about scars. There's spoken about being pink. It's not going to be pink in a Black person. You know what I mean? So things like that so that people can actually see people that have gone through it and come on the other side of it and are okay, I'm working on a podcast. And I actually just got the first episode today, so I'm like, I'm so excited. Tonight I'm going to listen to it. And, when you listen to podcasts, especially in the States, there's a lot of emphasis on, the physicians, the experts, which I think is important, and that's definitely going to be part of it. But I love to hear about the patient experience. I think there's so much to learn from patients, right? And patients learn from patients. Talk about people that have gone through this and come on the other side of it, So that's kind of what I want to do. So I'm hoping that people can reach out to me and let's talk about it. In culturally, sometimes it's taboo to touch our breasts, right? And it shouldn't be because it's medical. We have to talk about this. I mean, talk. We've got to do this.
Yeah, we got to talk.
So education.
Question for you, Dr. Ify, before we get out of this beautiful we're sitting in right now. And I have two more questions for you. One is car related because I know that you educated me on this last night and we had our meeting. And it's the parallel between this vintage beauty and the legislation and also the work that you do as a community leader. Please remind me again and share what you shared with me.
Okay, so like I mentioned, one of the reasons I want to use these vintage cars, this particular car we're sitting in, it's from, I think it's 1955.
Yes.
The Canadian screening guidelines, they're based on old studies, 60s, like old, 60s to 80s. And the problem with this is maybe it worked at the time, it doesn't work now. There are a lot of flaws to the study, which I'm not really going to get into.
Yeah.
But one of the major things, which maybe a lot of people don't know, but is that this study included probably close to 50,000 women, 40 to 49. 98% of them were white. Okay? So when you look at Canada now, it's a racially diverse country.
Yeah, absolutely.
So those rules that applied then, they don't work now. And when you look at this car, it's an old car, but there are parts that have broken down, right? The foundation is good. Parts that are broken down, we spoke to the owners of the car, they've changed some parts, and now it's working. This particular car started off red and white. Right now it's pink. So change is okay. We can do it. We need to change. We've got to adapt.
To evolve those.
Yeah, that's where the value is. Yeah, we got to rise to that occasion. Because if we leave it at 50, man, we're excluding a lot of people. Women are dying. Gotta fix it, Sam.
We gotta fix it. So, Dr. Ify, you do all of these things. We shouldn't be blindsided. Is it sighted or sighted? Sighted. Yeah. Okay. I will not be blindsided by
Sighted.
Sighted.
Blindside.
Okay, let me just leave that word. Let me just find that word again before I go and say something.
Blindsided.
Sided. Okay. Dr. Ify, I know, I see you, I know you see me see you, the work that you do. And it's a lot of responsibility you've chosen to dive into. But I can imagine all of the many walls that you have to jump over, all of the many obstacles you have to figure out a way to loop around it and still keep your sanity. How do you keep your sanity in this conversation where you are a minority, not just a Black person, but a Black woman? How?
You notice I took a big breath when you were talking that question. I need that breath because it's exhausting. That's just really, when you ask me that question, the first thing that comes to mind is a little bit of chest tightness. It's exhausting. It's hard to be in this position. I grew up in Nigeria, and there are things that have happened here where I'm reminded of who I am, what I look like. I always used to think that work was promised and that I could get to wherever I wanted regardless of what I look like. I know now that's not so much the case. And it frightens me, not so much for me because I'm a hustler. I'll do what I have to do. I'll hustle for me, I'll hustle for my patients to the end. It's just my children and the generation that's coming, And it's not to say they won't get there, but they need to be aware of the challenges. And so I always say, if you're going to do this, be passionate about it, like live, breathe it. And I do. In breast imaging, it's hard. There's a lot of, you have to be critical. You have to ask a lot of questions. You have to be picky. And that was a criticism. And you know what? It's okay. I am picky. I will fight for my patients. Every individual is personalized, right? So it's possible it comes with its challenges. So you do it with heart, do it with passion.
Yeah.
And have a good foundation, something to fall back on. And for me, it's family. That's why my husband is here. He's my rock, and no matter what happens, I can go home to my girls, and it's okay.
I was going to say the exact word used in describing your husband is a rock solid.
Brings a smile to my face.
Is a rock solid human being. On that note, friends, myself and Dr. Ife will remind you again.
If you haven't had your mammogram, have it.
Do it.
Be breast aware.
Do it. And
Take
you
care
see
of yourself.
my shirt.
Yes. Look at his shirt. Black women have the lowest survival rate for all subtypes of breast cancer. We have to end this.
We got to end this, friend.
If you've got breasts, you got to care about them.
If you got breasts, you got to care about them.
Yes.
Till we see you again, put a smile on your face. Love yourself, love others. You deserve it, they deserve it too.
That's right.
Peace.
Peace out.
Peace.
Anya mechago.
Anya mechago. Kita. Kodiechi.
It's kodiechi.
Kodie otutu.
Ole. Awesome.
Thank you.
Cheers.
Koti!